Hello, my name is Stephanie Bias of the Senior Medicare Patrol Program, and thank you so much for joining us today to talk about ways that we can empower ourselves to prevent Medicare fraud. We want to talk about, do you know how to prevent Medicare fraud and protect those benefits that you worked so hard for all of your life? People often say to us in the Senior Medicare Patrol Program, how in the world can someone have their Medicare benefits become a victim of Medicare fraud? People say, oh, I'm smarter than that. I'm not going to become a victim. The opportunity is there to become a victim of Medicare fraud. I would like to tell you a little bit about what the Senior Medicare Patrol stands for and what we do. We are the Medicare Fraud Prevention Program that is housed within each state in America, plus the 4 territories, so there are 54 programs. How are we funded? We are funded through federal grant dollars from the Administration for Community Living. We are there to make sure that you understand how to protect your benefits. People say to us, how much does it cost to use the Medicare Patrol Program? Our services are free, confidential, neutral, objective, and unbiased. Oftentimes, many of our Medicare beneficiaries are embarrassed to say that they've become a victim of fraud. They don't want to tell anyone because that may make them look like they're not in control of what goes on in their life. That is not true. Please do not ever be embarrassed to report Medicare fraud. So today, we're going to talk about some of the ways that you can protect your Medicare benefits from becoming victims of fraud. Each year, Medicare loses $68 billion with a B to Medicare fraud. That is $186,301,370 per day. Whose dollars are those? Those are yours. You want Medicare to remain solvent for years to come so that it will be around to protect you and your loved ones in your aging years. Are all Medicare beneficiaries older folks? No. There are many people that are on Medicare due to disability under age 65 that have been declared Social Security disabled, and they have been receiving a benefit from that, and that is your Medicare fraud. That is your Medicare due to disability. We also want to make sure that you know that there are many Medicare beneficiaries that are on Medicare due to end-stage renal disease. End-stage renal disease, or Lou Gehrig's disease, which is ALS. ALS. But the majority of the folks are on Medicare due to age, turning 65 years of age. That seems to be the golden year. Medicare came into existence in 1965 and 66, so it's been around for a while. But this year, the Senior Medicare Patrol Program is celebrating its 25th year of educating Medicare beneficiaries about their benefit and how to protect it from Medicare fraud. We have 3 key watchwords in our Senior Medicare Patrol Program: protect, detect, and report. People say, how do you get this message out? We provide opportunities for outreach and education, as well as wonderful partnership media efforts, such as what we're having with the Duke Caregivers Program. We're so pleased to be a part of this program each year. We want you to protect that Medicare benefit from fraud. Now, years ago, Medicare numbers used to be your Social Security number or whomever you drew your benefit from. That's just a huge form of identity theft. So finally, several years ago, they did change that and give you a number that is unique to you. It is a combination of numbers and letters. It has nothing to do with your date of birth, your zip code, your address, any of those things. It's just a combination of numbers and letters that are unique to you. Medicare benefits then are being used with that new number, that identifying number. We want you to protect your Medicare card that has that number on it, just like you would a credit card. Keep it in a safe place. Turn it upside down if you keep it in a card holder or your wallet, so someone standing behind you at the pharmacy or at your provider's office can't come behind you with a cell phone or with some type of a camera and write your number down. You don't want that. You don't want to have it stolen that way. People say, well, what are they going to do with that number if they steal it? They could sell that number to someone that doesn't have insurance, and they could be drawing benefits, your Medicare benefits, off of your card and your number and your name. How are you going to know that? We tell you to make sure that you read your Medicare summary notices carefully. You can sign up to get your Medicare number on Medicare.gov to track your claims online, or you can receive your Medicare summary notice quarterly in the mail. For years, I've seen Medicare beneficiaries walk in with a grocery bag full of Medicare statements that they've never even opened and checked for accuracy. You want to do that. People say, if I see something on there, what am I supposed to do? Well, if you see something on there that you did not receive as far as a number or a benefit or from a provider that you do not know, we want you to report it to that provider, to report it to Medicare, or report it to us at the Senior Medicare Patrol Program. This is the number that you can contact the SMP or the Senior Medicare Patrol Program Resource Center to find out where the program is housed within your state. That number is 1-877-808-2468. Again, 1-877-808-2468. If you didn't get that number, we'll share it several more times in our conversation today. People say to us, we want to make sure that we are a good steward of our benefit. The one thing I encourage people to do is when you call to make an appointment to see your provider and the person taking your call asks what you need to see the provider about that day, please make sure that you share with them all of the items that you want to talk to the doctor about or your provider about that day, so they will allocate enough time for your appointment. Keep a health care journal, kind of like a checkbook register. Take that journal with you to your provider's appointment, and when the doctor says, we are going to run these tests, or this is what I want you to do, write that down in your health care journal so that you will know when you receive those services. And then a few months later, when you receive your Medicare summary notice, you will have the opportunity to check it off and say, yes, I did talk with the doctor about that. Yes, these were the services that I did receive. Now, if you look at a statement and you see charges that you know you didn't receive, call that provider that is listed on the Medicare summary notice, because there are often times when there may be simple billing errors, a transposition of numbers, so make sure that you know that you can contact the provider. You always have the rights of appeal under Medicare. In your Medicare summary notice are the steps of appeal that are spelled out. If you have questions about how to file an appeal, we want to make sure that you have as much detailed information that you can possibly have about that charge. And you can call to our SMP Resource Center at 1-877-808-2468. 2468 to be connected to the Senior Medicare Patrol program in your state. You can file that appeal. That is something that is so important for you to be able to do. How many of you have ever had anyone call you as a robocall or something that shows up as potential spam? We knew that the moment that the pandemic hit, that this would be a field that would be ripe for scams. People were frightened. People were isolated from their loved ones. People were vulnerable that had never been vulnerable before because they were confined to home, perhaps. People just wanted to make sure that they protected themselves and their loved ones. But the scammers were just ready and waiting to call these folks on the phone. They would call and say, you know what? We already have an end to one of the best vaccines that is going to be out there. And if you would like to financially participate in this, you can become a rich person someday. We know that you're a Medicare beneficiary. They may not know that, or they may know that. But if you would share your Medicare number with us, we will put you in that pool. And if you would give us access to your banking account information, we can draft out dollars to help support this effort. Please, please do not give your Medicare number out to people that call you on the telephone. Even if caller ID states they are calling from Medicare, Medicare is not going to call you on the telephone. You need to make sure that you understand that. Unless you have called Medicare to ask a question, they're not going to call you back and say, I'm from Medicare and I need to make sure that I'm talking to Mrs. Jones today. Could you please verify your Medicare number with me? Do not verify that number. You hang up that telephone. Do not verify that information. Many folks have put spam blockers on their phones. That's a good thing. In the state in which I live, I go out and do a lot of presentations to a lot of senior groups. One of the most places that I love to go the most are to our congregate meal sites, our nutrition sites, where folks are now starting to gather again and share a meal at lunchtime. I went to one recently and they said, we've all put our spam blockers on the phone, but they're still calling us. This lady shared with me, Stephanie, I'm so upset because this person says that I can get a scooter if I will just share my Medicare number with him. He will have his doctor to write the certificate of medical necessity and I can get it and it won't be any cost to me. She says, I hang up the phone. But she said he calls back the next day. So when I was with her that day, I said, do you mind if I answer the phone? She handed the phone to me and I said, so you're trying to give my grandmother a scooter. Did she tell you that she won speed walking in senior games and she actually just walked up here today? She doesn't need a scooter. And they said, really? She doesn't need one? No, she doesn't. Well, does she know someone who needs one? And we said, no, she doesn't. And they said, well, we're sorry to have bothered her. And I said, and just for posterity, we have been recording this telephone call. They hung up the call and they never called her back. That's a good thing. So once in a while, she'll send me an email, say, well, you know what? They don't call me back, but guess what? Somebody else has picked up their place and calling me about something else. So people are receiving spam calls all the time and sometimes don't realize it. There are many scams that have been associated with COVID-19 besides the investment scam. There are people that are saying, if you received your vaccine, did you know that we can actually help store your vaccination record number? If you can scan your number and we will upload it for you and securely store that, and if you'll complete a survey, we will send you a gift card. No, the federal government is not going to ask you to upload your vaccination record from the Centers for Disease Control, from the CDC. Please make sure you don't do that. People say, well, I thought I would get a gift card, but I never got one and I uploaded it. We need to know about that. That is something that is a scam. Medicare is not going to send anyone to your door to provide a vaccination nor a booster. We want you to know that. That's not going to happen. They're not going door to door in your neighborhood. Please make sure that the information that we're talking about today is shared with your neighbor that couldn't listen to this opportunity today. Please make sure you share this information because it takes a village, and we want to be a responsible village to cut down on this $68 billion a year that we lose to just fraud, which, remember, is $186,301,370 a day that is lost to Medicare fraud. We want to make sure that you do not give your card out to folks that do not need that card. Make sure that it is your provider that you give that card to. No provider of yours is going to call you on the telephone and say, sir, I know that you are a Medicare beneficiary, but we're updating our records and we want to make sure that we have your Medicare number. Could you get your card and read that number off to us? Tell them no. And when you come to that doctor's office the next time you go for a visit, you will show them that card. Don't give it to people on the telephone. It is very important that you remember that. Always know, as I've said before, that it becomes your responsibility to read those statements, check them for accuracy, and file appeals. If you don't know how to file an appeal or you feel intimidated about that, please don't. Please call the Senior Medicare Patrol program in your state. And that number, again, is 1-877-808-2468. We have spent the last 25 years making sure that we protect Medicare beneficiaries and those benefits that they worked all those years for and paid into FICA taxes, that they are going to be able to reap the benefit of that. It's just like an investment that you have for your retirement is your health insurance. And as my grandmother used to say, if you've got your health, you have everything. We want to make sure that you know what to do. So, we want to make sure that we recap some of the things that we have talked about today. We have talked about the opportunity to protect your Medicare benefits by not giving your information out to folks that call you. Keep that Medicare number secure, even though it is no longer your Social Security number. Keep that number hidden and in a safe place. As the daughter of Medicare beneficiaries, I would suggest that you let your children know, perhaps your adult children know, or whomever is a trusted caregiver for you, where you've kept your card so that if something happens to you and you have to go to the hospital in an emergency basis and can't advocate for yourself, they will know where your card is. They will know where your card is. Make sure that you make the most benefit of your time with your doctor. Write down your aches and pains and your concerns. Keep a health care journal. When your Medicare summary notice comes once a quarter, or you look at your benefit on mymedicare.gov and you track those claims online, make sure they were services that you did receive and from providers that you know. You always know that you have rights of Medicare appeal. If you see something that sounds too good to be true, more than likely it is a scam. Do not upload your numbers or give it to anybody in exchange for things such as a gift card. You always have rights of appeal. We're there to help you. The S&P programs or the Senior Medicare Patrol programs do not charge. We do not sell. We do not tell you to go to a certain agent. We do not tell you to, give this to somebody else or to pass this along. We help you make the navigation of this healthcare crisis of Medicare fraud maze clearer. And if you think about it, it really are common sense tips. So, we want you to report anything that you feel is a scam. If it sounds too good to be true, then probably it does. I want you to become an army of one to protect your Medicare benefits. But I want to make sure that you not only become an army of one, you recruit that by telling somebody else something that you learned that day. Because everybody is susceptible to becoming a victim of all types of fraud, but especially of Medicare fraud. We want to make sure that Medicare is around for many years and remains solvent. We want to make sure that $68 billion per year is not lost going forward to Medicare fraud. And it becomes our responsibility to be the best steward of the benefits that we worked so hard to earn, that they are protected and are around for us to take care of us for years to come, and for your family as well. Please make sure that you involve your family members in your health care decisions. It's always easier to let them know before something becomes a crisis. So, again, my name is Stephanie Bias, and I work for the Senior Medicare Patrol Program. There is a Senior Medicare Patrol Program in all 50 states and the 4 territories, and I want to recruit you to help us become a good steward of our Medicare benefits and protect our Medicare benefits from fraud. Thank you so much for this opportunity, and I hope that you have a great rest of your day.